Do you know that antacids, Tums, Rolaids can cause a calcium challenge because it interferes with digestion in your body? Okay? That's really important. You don't want to be taking Tums and Rolaids for your source of calcium. There are better sources of calcium. Those items make great slingshot ammunition. So how much calcium should you take a day? Well, statistics will tell you anywhere from 1,200 to 1,500 milligrams. We do a lot of work with standard process, and what I found in my research, whole food calcium, is when we did all the research on calcium, it was so much because that calcium was not easily absorbed. So we don't need a lot of milligrams of calcium. You know, our calcium lactate product that we use here in the office, and calcium citrate, is really low dosage calcium. Now there's other ways you can get calcium than a pill. We'll talk about that in a moment also. Calcium's absorbed in your intestines. Okay, calcium's absorbed in your intestines. Let me go down to vitamin D and then we're going to come back up. Look at me up here. The sun converts the cholesterol in your skin to vitamin D. Sun converts the cholesterol in your skin to vitamin D. That's important. Why do you think we have a cholesterol issue in our society? There's a lot of reasons, but a lot of it is, for the last 30 years, guess what people have not been in? The sun.
Yeah.
Okay, so now everybody's supposed to be in the sun and taking vitamin D. So the vitamin D causes calcium to be absorbed in your small intestines. Now what you might not know is that vitamin D causes calcium to be absorbed in the body, and the calcium is in the blood. But people have a lot of skin cancer problems today, and skin problems, because they don't have enough vitamin F or like flax oil. In our office we use a product called Cataplex F that takes the calcium to your skin. So I'm going to be prophetic, I'm going to prophesy right now it's going to happen in the next year or two in America. If people keep on taking all the vitamin D, you know what's going to happen to them? They're going to get kidney stones and cataracts and arthritis. There's going to be an epidemic of kidney stones occurring in our society today because everybody's taking vitamin D. And I just told you what to do for vitamin D. Sunshine, 20 minutes twice a day. So if you need to know for me to have you go to Florida during the wintertime, I'd be happy to give you a note. But you know you got to take your chiropractor with you. So, but anyways, do you understand what I'm saying? Sunshine. Without sunscreen, because you got to watch the chemicals that are on sunscreen, because if you go to www.AmericanCancerSociety.com, or you can go and Google AmericanCancerSociety.com and look up carcinogens, and then look at the ingredients that are on your suntan lotion. I'm not saying all suntan lotions, of course, but you want to be aware of what you're putting on your body, because what you're putting on your body is absorbed by your body. So if calcium is absorbed in your intestines, if you've been on a lot of antibiotics or antibiotics at all, and you have digestive distress, you're not going to absorb calcium because your intestines are affected. Does that make sense to you? So you have to recolonate the flora in your colon, possibly. Okay, so if you're getting cramps at night, you might not necessarily need more calcium. You might need to get your colon intact. Let me give you a little rabbit trail here. Are you ready for this? People who have chronic sore throats comes from colon toxicity. Chronic sore throat, colon toxicity. So if you have a chronic sore throat and you have colon toxicity, you're not going to absorb calcium. If you're not absorbing calcium, the cells aren't going to hold together, and guess what you're going to get in your body? A virus, the flu. Can you see how all this is tied together? So if you eat sugar, sugar depletes the body of calcium, you're going to have more of a challenge. Now if you remember at the beginning of the program I talked about bowed legs. I just love going to the mall, and even the summertime is the best time to look at people's bodies. It's amazing. You should just follow me around. I can tell you so much what goes on inside. I look at bodies for a living, but if you see a man, you know, the pasty milk leg syndrome with the white bowed legs, that boy needs to be in the sun a little bit more, is what he needs. He needs to get more minerals inside of his body. Now, parasites can also take minerals out of your body. If somebody's grinding their teeth at night, they have bowed legs, chances are they may have parasites. If they eat wild game, if they eat sushi, they eat pork, if they have a cat, for sure they probably have parasites. If somebody has white hair, I'm not saying, don't say we have so much color we don't know who's white and who's gray, but it's always amazing as you can see a man whose hair is white and his wife had this gorgeous dark hair and I think, wow, what is going on there? Well, you know, it's coloring it, I'm sure. But white hair is a sign that your thyroid gland is not functioning optimally. and your thyroid gland not functioning optimally affects calcium. Calcium's being deposited in your hair. I have people's hair color change by giving them more iodine and getting their thyroid gland going. Now, this is also something I think you'll find fascinating with calcium. If you're in a lot of stress, if you're underneath a lot of stress, and you get cold sores, lack of calcium. Poison ivy, lack of calcium. Colds, lack of calcium. So you want to make sure you have enough calcium in your body. Calcium lactate. Stress, cold sores, poison ivy. If you're in the sun a lot, you want calcium lactate. If you happen to be a northern bird and you're a snowbird during the wintertime, when you go down to Florida or anywhere else that is sunny, you want to take Cataplex F and calcium before you go so you don't catch a cold when you're down there. Because what's happening is you're losing the calcium inside of your body. So you have a greater chance to catch a cold when you're exposed to a lot of sun. So what kind of calcium do you use? Well, in our practice we use calcium lactate or calcium citrate. They're acid calciums. They're not sourced from milk. And your body actually can make them. We actually use a product called lactic acid yeast. It helps make the proper nutrients inside of your body in the lower bowels. Do you know that an ounce of sesame seeds, 1 ounce of sesame seeds, has the equivalent of 280 milligrams of calcium? Now I encourage all of you to put sesame seeds on your food. You should put it on your salad. You should put it on everything. All of you could be doing at least an ounce of sesame seeds every day. Just sprinkle them on food. So that's 300 milligrams nearly of good, viable calcium. Now I'm going to tell you something else that my wife and I have just started to eat, is kale. Now, kale is interesting. When you look at these big green leafy vegetable leaves, they look like they come from Jurassic Park. You know, they're big and green. They're not very attractive looking. They are tough, but they taste good. I'm going to give you the Dr. Bob's secret recipe for making kale. So you take this kale, and you cut it up, and you put it in a large mixing bowl. Okay, and you kind of fluff it all up, and you sprinkle it with olive oil. Okay? So in the meantime, you have a frying pan that's you have a little bit of oil in there, and you've sauteed some onions and some mushrooms and whatever else you want to do, green olives, black olives, anything. Just sauteing that in there, and you take the kale that has olive oil on it, and you throw it in that pan. You know, I just love that noise. So the kale hits the hot frying pan and makes a cute noise, and you kind of swish and you're fluffing everything around, and then you let it cool just for a minute, and you eat it. And I'm going to tell you, my wife and I can eat a whole batch of that kale one sitting, and the other day we just happened to go to Trader Joe's and get some turkey cutlets. Turkey cutlets, sauteed in onions with the kale. It's awesome. Great source of calcium, great bowel movements the next day. So if you're having bowel challenges, the kale will make a difference. Great source of calcium, broccoli. Broccoli, cabbage, cauliflower, beans, green beans. See, I think that we have it all wrong in America today, because everybody thought that maybe my half-hour health today was going to be about yogurt and ice cream. I don't even have yogurt and ice cream on here, because yogurt and ice cream have sugar in it, and they have other issues. So everybody always sometimes will say to me, well, Dr. Bob, if I don't use yogurt or ice cream, where do I get my calcium from? And the common response to them is, when's the last time you saw a cow eating cottage cheese milk or ice cream? They don't. What do? They eat hay, grass, and alfalfa. So I'm not telling you to eat hay, grass, and alfalfa, but what I'm saying to you is, I like you to eat almonds, I want you to eat sesame seeds, kale. Try the kale. And I had somebody yesterday at the half-hour health, so it's kind of bitter. You know, it's not necessarily the sweetest, but it really tastes good, especially if you throw the mushrooms in it, and the onions, and the green olives, and the black olives, and try to throw some asparagus in with it also. Now, do you know what can really cause osteoporosis and take calcium out of your body? Soda. Soda pop. Phosphoric acid. And when you go home, I want you to look at the old cans that you used to have from your soda pop, that, you know, your recycled cans, and you look in there, it'll say phosphoric acid. Phosphoric acid will take calcium out of your body. Okay, that's very, very serious. It depletes calcium. Now, what can help the absorption of calcium in your body is vitamin C. I encourage our patients to use red peppers, yellow peppers, and orange peppers. Great source of vitamin C. So you can use those, and that will help you, especially if you're going to be eating your almonds and that during the daytime. You're you're going to get some natural vitamin C inside of your body.